Welcome back to another episode of the Shared Practices podcast. And I'm here to talk about an interesting episode about the top 4 levers that actually make a difference when driving growth. And this actually stemmed from another podcast episode I was recording with our CEO, Alex Sharp, where we were talking about multi-location groups and differentiation. And one of the things that sort of came out of that conversation was Alex was at a conference that was really geared towards DSO practice owners. And a lot of them are multi-location general practice groups. So, you have 10, 20, 30 general practices in a group. And one of the things that they said in the seminar, which I thought was very interesting, was they talked about how there is very little same-store growth that occurs in the general practice space. And so they said that if you're growing more than 10%, you are either lying or you are in Alaska. And it was kind of interesting because on both sides of our business, so our business has really 2 sides to it. There's the dentures and implants focused full arch DSO shared practices group. And in that segment, our same store growth has exceeded 30% year over year for multiple years in a row. And then we have the coaching side of our business where we help GP practice owners scale and grow their practices. And over the last 4 years, our average year-over-year growth has been somewhere between 37 and 39% for 4 straight years. So whether we're talking about a specialty dentures and implants model or we're talking about growing general practices, we have multiple years of consistent track record of 30% or more same-store growth. And in our industry, that is considered very uncommon. And so I thought, well, let's just talk about it, right? I want to do an episode where I talk about how do you drive same-store growth, whether you have one location and you're trying to drive growth in your single office, or you have multiple locations and you want to drive same-store growth across all of your locations. And in the DSO space, we call them stores. So if I accidentally call them stores or same-store growth, I know that dentists can find that to be maybe a abrasive term because it's like this is a healthcare business, it's not a store. But it's just sort of the vernacular that sometimes I get caught up into. So nonetheless, in this episode, I really want to focus on driving same-store growth or same location growth, right? So let's just say you're a solo dentist doing 1.2 million. This is going to talk about how do I get to 1.5? Or if you have a group practice and it's doing 2.2, how do we get it to 2.6? Or if you have 3 or 4 locations, how do I grow each of my locations so my entire top line grows 30% across all of my locations, right? So that's essentially what I'm going to be doing. And so I think that the best place to look is our coaching department. And so our coaching department at any given time is coaching around 100 practices. And so there's 100 practices that year over year we grow 30% or more. And how do we do that? Well, you have to look at the constraints on these practices. So if we were to say, maybe I'm not trying to criticize other companies that do what we do, but I am going to talk about a different approach that is not effective to contrast that with our approach, which has shown to be much more effective. And so imagine let's just say we were shared practices, the coaching company, and we had sort of like our core system, so to speak. And every single person that comes to us, we're going to say, all right, we are going to start with this. Then once you get this system in place and your whole team is behaving a specific way, then we're going to introduce the next system. Then we're going to introduce the next system. Then we're going to introduce the next system. Essentially what we'd be doing is we're treating all of the practices the same, and our way of growing these offices is systematizing their behavior so that they are doing everything the same way that all of the practices do, and that's how you're going to get growth. That doesn't really work because, one, it's highly disruptive. So the whole team receiving this sort of standardized training is going to, it's not going to feel applicable to their situation. And so that's sort of like running everyone through the same course of options. And so if you are a solo practice owner, that would be like saying, all right, I have a list of systems. We're going to introduce one a month. And then for the next 12 months, we're going to have a fully systematized practice. And if you're a multi-practice owner, it'd be the same type of thing, except for you're saying, I'm going to introduce across all of my locations one initiative a month for the next 12 months. So that in 12 months, we've introduced 12 initiatives and they've landed. And I think one of the hardest parts is to do this properly. You have to have what I call a surgical approach, which is, this is what I would call a general approach, which is everybody receives the same treatment plan and training and systemization. But the reality is that not every practice has the same things that are inhibiting its growth. So for example, let me use some specific examples. So let's just say you're a dentist and you are that solo dentist that we talked about doing $1 million a year and you want to do 1.5. Well, it would depend on if you're checking for one hygienist or if you're checking for two hygienists. If you have two hygienists and you're completely slammed in hygiene, then your path for growth is going to be much more focused on case acceptance and diagnosis and treatment planning, because you're not going to want to go to checking for three hygienists. So a patient flow driven method of growth isn't really going to get you to where you want to go. However, on the other side, if you're doing $1 million a year with one hygienist, then the easiest way to grow your practice is to just grow the patient base to have that second hygienist, and then you're going to get to the 1.5 on accident and candidly probably a little more. And so it's all about having this microscope on each practice and looking at the different components of the practice and then saying, where is this practice strong and where is this practice weak? And where is, you call it the leverage point, or where is the place, the lever, where if I grow this thing, then revenue is going to grow the most. And so you're looking for the constraint, and then you use that sort of constraint to then customize a treatment plan to make sure that you are targeting the practice's biggest weakness. Let's use percentiles as an example. So we use practice by numbers. We love practice by numbers. And one of the things practice by numbers does is it tells you a percentile for a statistic. So if, for example, if you're in the 75th percentile, that means that of the people who use practice by numbers, which are a more driven, in sophisticated crowd of practice owners, so of the more driven, sophisticated practice owners in their database, you are better than 75% of them at something, which means you're pretty good at that thing. And then if we were to say there's another statistic where you're in the 25th percentile, that would say, okay, well, of the people that are using practice by numbers, you're only better than 25 out of 100, which means 75% of the users are better than you at something. Right? So you're going to get way more return on investment of your time, effort, and your culture cost of introducing change if you're able to focus on where you're weaker. So taking that 25th percentile and making it a 75th percentile is a drastic improvement, which would yield a lot of results, compared to taking that 75th percentile and making it a 90th percentile. It's probably the same amount of work. It's probably the same amount of effort for you to take a 25th percentile and make it a 75th percentile than it is for you to take a 75th percentile and make it a 90th percentile. Because as you get better at something, it's harder to get even better. So I think a really good example is reappointment rate. So the 25th percentile in practice by numbers for reappointment rate is something around 50 to 60%, which means that in your hygiene department, 50 to 60% of your patients who are coming in for a cleaning are making their next visit. So if that's the statistic that you're trying to drive, it's really easy. Now, I hate to say this, and sorry if this is offensive to anybody, but it's relatively easy to go from 50 to 60% to 85%, for example, which would take you from, that lower percentile to maybe the 60th percentile. It's a lot harder to go from 93% to 97%, for example, because there's low-hanging fruit in all of these opportunities. For example, there's maybe a group of patients, you guys just don't bring it up in the right place. If you bring it up in the operatory, then there's a group of people that would actually move forward with that suggestion of making their next appointment. And so when you're trying to improve and you're trying to grow a practice on the same store, you want to use data analytics, and we use heavily practice by numbers to look at a practice and say, okay, where are their biggest growth opportunities? And then you need to target them. So you say, okay, these are the practice's biggest weaknesses. These are the things the practice is strong in. And so if the practice is strong in an area, we probably don't want to focus on that. We just say, hey, keep doing what you guys are doing. Maybe it's not systematized. Maybe it's not ideal. Maybe it doesn't follow the exact process that we would recommend if we were starting from scratch on how to do case acceptance or how to answer the phones. But according to our data, it's not your biggest problem. So we're not going to focus on it. And so you can see here that this is the type of thinking that it takes to really drive growth at a specific office. And so, like I mentioned before, in our coaching department, right, this is the type of thinking that we use to drive growth across 100 practices, right? And if you're a multi-location owner, this is the type of growth that you would want. This is the type of mindset you would want to use to drive growth at each of your individual offices. And so this, again, is going to put you in a situation where you are treating each practice as an individual and not as part of a group. And that's the first step to really driving growth, is understanding that each practice is unique. It has unique strengths, unique weaknesses, and it needs a unique customized treatment plan on how to grow that practice where you're going to get the strongest return on investment. All right, so now we've sort of talked about, okay, these are the areas that this is how you have that surgical mindset. Now, let's just go through a few different examples of some things that you could do that would drive growth. So I think the obvious one that I'll start with is patient flow growth, right? This is most likely going to be a major driver for people. So you look at your practice, you say, all right, if we just saw 20 to 30% more patients, we would be highly effective at, we're already good at case acceptance. We already have a strong doctor foundation. We already have a team in place. We just need to see more patients. And so, we call this the dental three-pointer, is like, that's, we're really well known at this point for growing hygiene patient bases. And so, starting a practice with 1,000 patients, for one doctor, well, one doctor checking for 2 hygienists should have around 1,600 to 1,800 patients. So we look at that practice and we say, all right, well, you just need more patients. That's going to be the highest return on investment. So we're going to focus our effort and resources on growing that patient base so that then the doctor can grow their revenue by having more patients. And how do you do that? So our process is called ROF, retain, open, fill. And so retain really means in hygiene, reappoint, right? Because that's going to be your most effective form of retention. And so if somebody is in hygiene and they make their next visit, then, there's maybe like a 10% chance that they're either going to cancel that visit or they're not going to show. In the case that they cancel it, they're actually calling you to cancel the visit. So you have the opportunity on the phone to reschedule them. Versus if they walk out of that appointment without the next visit made, you are chasing them. And there's a 10 to 20% chance that you actually get them on the phone and get an appointment scheduled. And so the overdue recare list is a very hard place to reactivate people. And so preventing people from getting onto the overdue recare list is the most effective way to retain your patient base. And so if we're trying to grow somebody's patients, the most important thing to do is completely lock the back door so that we then are limiting the amount of people that are leaving, which we could be more aggressive on opening the front door because we know that once we get patients in, they're going to stay. And so that allows us to be more aggressive and take a little bit more of a risky approach, which will allow us to grow our patient base faster. And so the last thing I'll say on this is people think like your reappointment rate is very similar to the grades you get in school, right? Somebody gets a 93%, someone gets an 82%, someone gets an 85%. I just find that the numbers kind of fall in that A, B, C range. And so it kind of, without even thinking, it really gets you into this mindset where you're like, oh, I got like a B on my reappointment rate. It's 85%. Like, that's fine. But let me explain. So it's not about the reappointment rate, the 85%. It's about the percentage that don't book, the 15%. So let's use an example that's round numbers. So let's just say your reappointment rate is 84%. You'd be like, oh, that's a B. Yeah, we're not the best at it, but we're pretty good. That's what you might think. Well, 16% of people leave without their next visit. Now let's say that someone else is a 92%. You're like, oh, how much better is 92 than 84? You'd be like, pretty good. I don't know, a little bit better. And you'd say, yeah, maybe. But the reality is that 92% is twice as good as 84%, because 16% of your patients, when you reappoint 84%, are getting on the overdue recare list, where they are very hard to get off. If you are reappointing at 92%, a mild to moderate improvement in terms of effort, half as many people, 8%, are getting on that overdue recare list. The overdue recare list is where patients go to get lost. And so the person reappointing 84% is losing twice as many people to that overdue recare list than the person reappointing 92%. And so be very careful on this retention piece, because you may think that you're doing good, but mild improvements to get into the low to mid 90s at this metric are twice as good as the mid 80s. And so it's a very different mindset. You don't think that a B is half as good as an A when you're getting grades in school. But the reality is that when it comes to your reappointment rate, it is 84% is half of 92% when you talk about what really matters, which is the number of patients that end up on the overdue recare list. So retention, super important. Once you've retained, our whole system is opening up the schedule and filling those openings. So the ROF is retain, open, fill. And so this is our sort of like, at this point, we've put it in multiple books. Like at this point, we've really solidified this as a core element of our philosophy, is that if somebody comes to us and they need more patients to drive growth, we're going to be retaining, opening, and filling. And we're going to open up the hygiene schedule. We're going to take strategic risks in opening up the hygiene schedule. And we're going to be filling them with extra patients, whether that's from the overdue recare list or that's new patients. And something that is a new trend here is that in this hygiene shortage that we are experiencing, people with hygiene openings get patients because most offices that they call are booked out 3-4 months for a new patient cleaning. And it's like, if somebody has the wind to come go see a dentist, they have the desire finally to go get their teeth checked out, which they haven't for multiple years. They don't want to wait 3 to 4 months to come in. They want to come in sooner than that. And so if you have openings in your schedule, you are going to see more new patients. It is just, I would say that our philosophy has changed with the hygiene shortage in 2 different ways. In one way, it's very hard to get hygienists now, which is harder to implement our philosophy. But if you are able to get hygienists, it is easier to fill openings because they're more scarce. There's a general shortage in the population of hygiene openings. And so if you have hygiene openings, they fill. So that's going to be really how you drive the patient-based growth, is you're going to retain your patients to close the back door. You're going to open more slots in hygiene, and then you're going to fill it. And it's going to be something that compounds. Every 6 months, you're going to add more and more patients to your hygiene subscription service, and then you'll have more patients in your practice, and you'll have more revenue, and you'll drive that same store growth that we're talking about. So that's sort of the first big item. The first big lever is growing the patient base through our retain, open, fill dental 3-pointer system. Now, the second way is, I would call it case acceptance. And so case acceptance is going to be your next major lever. So how do you know you have a case acceptance problem? Well, if your patient flow, so like when you're going down the checklist, I would say, okay, number 1, do we have enough patients, right? You should always ask that question first. And if you have enough patients, then check 2 is, how's our case acceptance? And case acceptance is going to be looking at, the percentage of treatment that you're getting accepted. You got to look at your patient acceptance, which is the amount of patients that say yes to something, or you could look at your treatment acceptance, which is the total dollar amount that patients are going to be accepting. So your patient acceptance, you're going to want 70 to 80% of your patients to say yes to something. Your treatment acceptance is you're going to want 30 to 40% of your diagnosed treatment to be accepted. So those are going to be some of the statistics that you're going to want to look at to evaluate your case acceptance. This is the type of thing that if you find that you have an opportunity here where you say, oh, wow, like 60% of my patients are saying yes to something, and we're only getting a total of 15% of all of our treatment diagnosed accepted. Well, then you're like, whoa, you're in the 25th percentile for case acceptance. And this is a very fast lever because you say, if I train my team on case acceptance, patient education, financing options, and allowing patients to make it easier for them to say yes, then I can increase my production 30% pretty quickly. Right? Think about it. If you are getting 15% of your treatment accepted and you do nothing different other than improving your case acceptance and you go to 30% of your treatment accepted, you are doubling the amount of doctor production that you are pulling out of these exams without diagnosing anymore. So case acceptance is another lever that if you find your practice has this as an issue, focusing on it will allow you to grow your practice substantially. And so your treatment acceptance, the percentage of the total diagnosed treatment that you get accepted, growing that grows your doctor production. And so this is a way of saying, okay, we're not going to see any more patients. We're not going to diagnose any differently, but we are just going to really help drive the amount of treatment that we get accepted. And this is one of those that, like, when we, as a coaching department, when we find a dentist that has this type of configuration, and there's actually one on the mastermind I'm thinking about right now. So he knows who he is if he's listening to this, where he had this. We started working with him. He had 2 hygienists and, was doing sub-million per year in dentistry. And, the dentistry was there to do. So it wasn't like he had to change the service mix he was offering or anything like that. It was just a matter of being intentional about working with his hygienists on, the 3-person conversation between the doctor, the hygienist, and the patient, getting the co-diagnosis in place, helping him have his team be a little bit more effective about taking intraoral pictures and telling patients multiple times about what they need before they come in for the exam. And then also being intentional about the handoff at the front office, right? So those are sort of the elements of how you drive case acceptance, at least through our team-led approach. And shared practices in general, we tend to go for a team-led approach, which means we really prescribe to the philosophy that, think about it, right? If we were to coach this doctor and we were to say, hey, your case acceptance is your biggest lever, what we want you to do is learn the best way as a doctor to get case acceptance. And then every time you go in an exam, you go in intentional about taking time to explain things to the patient, being present and available, making sure that you're there to answer all of their questions, being a very nice chairside presence. The reality is that this doctor is going to have good days and bad days. They're going to have days where they're called out for an exam in the middle of a class 2 where they have everything isolated and ready to go. And they're like, oh man, could you have picked a worse time to call me for an exam? Right? There's the reality of the fact that as doctors, when we get called out to do exams, we're all in the middle of all types of things. And so the most predictable and consistent way to get case acceptance is when you are looking at the ability for you to actually be consistent. And that's going to be something we talk about next is consistency. But that's where your team, they have much more time with the patient. They have a whole lot less going on. Your hygienist isn't bouncing around between 3 different rooms. You are. And so use the fact that your team has more time and dedicated attention for the patients to have them drive the process so that you're coming in with less work to do so that on the good days and bad days when you're busy or not, your case acceptance is much more consistent. And so that's the second lever, right? The first lever was patient flow. We talked about that with the retain open fill. The second lever is case acceptance. We just talked about that with the team-led approach, how to identify the issue if you have it, and then how to drive the performance if you need it. And then the third one, and this is one that I think is very important, is consistency. So this one is a little bit more nuanced. And so this is going to come up in a group practice environment or even in a multi-practice environment. So let's just say we're in a group practice environment and we have 4 different hygienists. The way that this lever looks is we would say, you would ask yourself, you say, which hygienists are the best at taking intraoral pictures and helping me, talk to patients about treatment so that when I come in, they're hearing it for the 3rd or 4th time instead of the first time. And that's going to be your consistency. So if you have one hygienist who's excellent, you say, oh man, this hygienist, Susie, when she comes in and gets patients, their intraoral photos up every time. They come in and say, hey, doc, look what I need. I need a crown. And, it's like a very different experience for you doing the exam. They're very thorough. They go through things. They take a lot of pictures. They explain things to the patient. They understand your diagnostic preferences so that they understand most likely what you would recommend in certain situations. And they can have that conversation with the patient so that by the time you tell the patient the diagnosis, the patient is not surprised. It's not something you have to explain. That's one of the hygienists that is, maybe your stronger one. Then there's another hygienist who is running late, doesn't take the pictures, and every time you come to do their exam, you would say, oh man, I got to go take the picture. It's a lot more work for you to get patients to agree to and understand their needs coming out of that hygiene chair. And so if the gap between your best and your worst hygienist is big, then you may have the lever of consistency, which is essentially saying, if my hygienists were all more consistent, then we would perform as an office a lot stronger. And so that is where some type of standardized process or system would come in place to create consistency. And so standardized processes and systems are really effective when it comes to elevating the floor, right? So your top performer, the one that's already great at what she does, if you come in and introduce a process, it's not going to really drive a whole lot of growth. She's already good. She knows what she's doing. And if all of your hygienists are like that, then it wouldn't come up on our radar as a weakness. But if you look at 4 different hygienists, and between the 4 of them, there are 2 that are mediocre, 1 that's weak, and 1 that's really strong, then that's where you could potentially have consistency as a lever, where you say, you know what? All I want you guys to do is to be more consistent amongst each other, and maybe you can get the 2 mediocre ones to be closer to the really good hygienist, and the one who's the poorer performer to be a little bit more than mediocre, right? And that's going to do a lot for your practice to drive growth, because it's going to make it so that there's a lot more consistency, so that you're taking advantage of the full volume of patients that are coming through your office when it comes to the ability to get them understanding their needs and getting them to say yes to treatment. And so consistency is a little bit of a nuanced one, and it comes into effect when you have a larger practice, or you have multiple locations, or you have multiple providers who are differing in their performance. And this could be seen with associates as well. Let's say you have 3 associates, and you have one who's a really strong performer, one who's a so-so performer, and one who's a poor performer, right? Working on your consistency with your doctors could potentially yield a lot of growth. And so you can see here that there's a general theme. There's a theme of saying, okay, we are going to want to drive growth by treating each office as a unique microcosm of the different systems that go into running a practice. You have your patient flow, you have your hygiene production, you have your diagnosis, case acceptance, doctor production, you have your overall collections, your profitability. Like, all of these are different components of a dental practice. And so when you want to drive same-store growth, you want to look through your analytics, and we love practice by numbers for this, to really say, okay, what can we find here? Where are the biggest opportunities? And the percentiles will be very helpful, right? You want to identify where am I weakest and where are my weakest links, and you want to drive those areas, and you want to treat each component of the practice uniquely, each practice uniquely if you have multiple. And you really want to focus on that idea that you should focus your time and effort on where you have the lowest hanging fruit to drive the most growth to get to the most results. And then the next one is general efficiency. So again, our first one was driving patient flow growth with our retain open fill dental 3-pointer. That was the first lever. The second lever was driving case acceptance. The third lever is driving consistency amongst team members at the same position, whether that's hygienists, assistants, doctors, front office. Front office less so because they're more specialized. And then the next one is efficiency. And so efficiency is taking a look at your practice through all of the components and looking for leakage. So for example, my missed call rate. If we have a very high missed call rate, we are inefficient at answering the phones and scheduling patients. If we have a good missed call rate where we're maybe only missing 10 to 15% of our calls, but we're not converting a lot of those new patient visits into, or new patient calls into new patient visits, then we have an efficiency problem on the phones. And efficiency is one of those things that could even touch, case acceptance. It could touch, your diagnosis. Efficiency is a very broad term, but it's sort of the last thing you're looking at. So if we've looked at our patient flow growth and we see, okay, the correct number of patients are here. If we looked at our case acceptance and we saw, okay, case acceptance is strong. If we looked at our consistency, we said, okay, we're very consistent. Then we're going to say, where can we get more efficient? And you're going to look through the whole process again for inefficiencies. And those are going to be the areas where you're going to want to focus your time. Now, I would say that efficiencies are also something that's baked in throughout the whole 3 things that we've already talked about. For example, case acceptance is an efficiency thing. How efficient are you per patient, right? That's efficiency. Consistency, right? If you are more consistent, you will be more efficient. And so efficiency is sort of the catch-all that says, okay, these are like kind of the 3 areas that we look for inefficiencies. And now, if those 3 check the box, are there any other inefficiencies that we could see at any other part of the process? Then you're going to look generally at all of your analytics, and you're going to say, where am I the least efficient? And then you're going to want to focus on that. I think that this goes to, the experience, and I want to say this idea of whack-a-mole, right? So a lot of times when I've lectured recently and I've introduced this concept of constraints, or I talk about this in the mastermind calls, we talk about this idea of that you're playing the game of whack-a-mole. And the day-to-day of achieving same-store growth feels a lot like whack-a-mole. And whack-a-mole is that arcade game where the hedgehog or whatever animal it is comes out of the hole and you whack it down. and then it's down, and then the next one pops up. And so that's like the perfect term to describe efficiency, is that you are looking at your entire practice through all of the components, and you're looking for the inefficiency that's sticking out like a sore thumb. And then you take your operational focus and your team and your time, and you improve that inefficiency to drive a metric from inefficient to efficient. And that is your way of whacking that mole. And then what happens is a new one pops up. And then you're like, oh, well, now I got to whack that mole. And so really, at the end of the day, the process of driving same-store growth is this like relentless process of looking for inefficiencies, making them more efficient, and repeating that process over and over again. And so going back to the original premise of the episode, we talked about this idea that like in dentistry, right? Like Alex, our CEO, he was at a DSO conference, and they said that if you're growing your group by 10% or more per year, and this is in the general practice space, then you are either lying or in Alaska. And I'll push back and say, if you're not growing your group by at least 10% or more year over year, you are not focusing on your inefficiencies. You're not focusing on where you have the most value to drive, and your focus as an owner is not where it needs to be. Your most valuable resource in your business is your own time and energy working on the business. Let me use this as an example. Right? Let's just say you're a group practice owner. You work 3 days a week, and you have like a 4 to 6 hour admin period every week where you're actually running and driving the business. That means that you have maybe 15 employees all working 40 hours a week. So, that means that every week you have 600 hours of team members who are working in that practice every week. And there are 4 to 6 of those hours that the owner is spending on the business. That is 1% of the labor hours of that group. So if you have a 15-person team working 40 hours a week and you spend 6 hours on the business a week, that is 1% of the amount of time that people are spending on the business. You think about that. So if you, the owner, are not spending your 6 hours a week or however much you dedicate to your practice on the core drivers of revenue, you are not looking through your analytics, looking for the biggest opportunities, and very focused in your leadership of the team on getting the 600 hours of labor that you have each week, driving whatever you think are the biggest opportunities. And no, you will not grow your practice year over year, and you will not achieve attractive same-store growth. But to say that it's not possible is something that, candidly, I very much disagree with, because on the specialty side, in what we do, very implants focused with Shared Practices Group, we have had this mentality for multiple years, and we have grown our revenue multiple years in a row at the same store level year over year, right? We have shown year over year you can continue to do this. And on the coaching side, for general practices, we have taken 100 offices and collectively grown them by 37 to 39% multiple years in a row for multiple years with this approach. So I go to say that if you want to drive growth in your practice, you really need to be focusing your time on the areas where you are the least efficient, where you can drive the most growth. And you need to do that by following the process that I laid out, right? First thing, look at your patient flow. That's going to be your lowest hanging fruit, is if I drive more patients, I drive more revenue, right? So is there more patients to drive here? Then number 2 is your case acceptance. Are we just not converting treatment that we're already discussing with patients? Then the third thing is my consistency. How is my consistency across the different positions where I have the same team member, right? Dental assistants, hygienists, dentists, right? Your clinical team members are the ones that are very redundant. So you're going to look at your consistency amongst your clinical team members. And then you're going to say, all right, I want to play the game of whack-a-mole. Where are my inefficiencies? Where can I improve the most? And that's where you're going to use your percentiles and all of your different KPIs to say, where are we the least efficient? Where's the sore thumb sticking out? Or where is that mole that is popping its way out of the hole? And how do I whack that guy down by going from inefficient to efficient? And you just keep doing that over and over again. You're going to drive same-store growth. So we got this episode because Alex and I had a conversation. We talked about this, and then we had people reach out to us at team@sharedpractices.com and said, this is a really interesting concept. Please, I'd like you to talk about it some more. So if you like this episode and you want us to talk about more things like this, reach out to team@sharedpractices.com and give us your feedback. What do you want us to talk about on the next episode? And if you appreciate listening to the podcast, then I would encourage you to come back to listen to more of the Shared Practices podcast, where we take dental practice management on a day-to-day basis, and we just keep talking about it. We've been doing it. This is our 10th year of talking about dental practice management, and somehow it doesn't get old because it keeps changing. The industry is changing, and we're here to talk about the changes, and we're also here to talk about the ways to succeed in the modern day in dental practice ownership. So thank you for listening to this episode of the Shared Practices podcast. I look forward to seeing you back on another episode, and again, thanks for listening during our 10th year of production.
Resonate.